Chickenpox is the topic, also known as varicella, and at the end I have a few clinical vignettes to share. Well, chickenpox is the name of the condition, and another name for it is varicella. Now, I want to make a few things clear so it's not confusing. This condition is caused by a virus named Varicella zoster. So, also sometimes abbreviated VZV. Now, what's important to remember to avoid confusion is that chickenpox is what happens in the acute phase. It's the acute phase of this virus. Later on, maybe sometimes years later, you get a condition known as shingles, which is also known as herpes zoster. And that is a condition that happens because of the reactivation of this virus, the reactivation of the latent phase of the virus. So just keep that in mind. Don't confuse the two. And shingles, essentially, very quickly, it's a very painful rash that occurs in a dermatomal distribution. So that's essentially the two rashes that are caused by varicella zoster virus. But in this video, I will concentrate on chickenpox. So, how do you distinguish chickenpox? Well, most of the time it happens in kids, and it's described either as papules or vesicles, and they're usually on these red bases, and they kind of appear in crops, and later they can become pustular, and then later they can crust over. Now, the location where they can appear are often the face or the trunk, and they tend to appear in crops, so keep that in mind. One very characteristic symptom is that they're very pruritic, very itchy. And in terms of contagious, they're obviously contagious, but they cease to be contagious when all the lesions have dried and crusted over. So that's an important thing to remember on clinical vignettes when they're talking about when these lesions are crusted and dried. Then that's pretty much when the rash is no longer contagious. Unfortunately, the rash by itself is sometimes not the only thing. There's complications, and there's several of them, but they're quite rare. So I really just wanted to talk about the most common one. And the most common complication of chickenpox is secondary bacterial infection. See, what happens is the person starts itching, and when they itch, they can cause this bacterial infection of the vesicles. And the most common bacteria are Streptococcus and Staphylococcus. So just keep that in mind in terms of complications, the most common. Diagnosis is really just a clinical diagnosis, looking at the rash. So I encourage you to look up pictures of this. On the internet you'll see these red vesicles or papules, oftentimes appearing on the face or the trunk, in crops. Treatment. There's really two cornerstones to treatment. There's treating the virus with antivirals, so medications like valacyclovir or famciclovir. And then the other part is, of course, treating the pruritus, because that's a very significant part of the rash, and that's usually done with antihistamines. And you're not only trying to relieve the symptoms, but you're also trying to prevent secondary bacterial infection that can happen when a person is itching profusely. And one final thing before I get to the vignettes is that there is a vaccine. It's called the Varicella Vaccine, appropriately. And this vaccine is used to provide effective prevention of this condition. So now let's take a look at some clinical vignettes. One morning, a 77-year-old woman woke up feeling vaguely unwell with too little energy to get up to do anything. Later in the day, she developed a headache and by bedtime a low-grade fever. That night, her sleep was disturbed by an itch on the left side of her waist, and by the morning she felt an itchy, tingling, stinging, throbbing sensation interspersed with sharp stabs of extreme agonizing pain. 2 days later, a hive-like rash appeared on her waist in the same area as the pain. The rash made a belt-like pattern in a stripe that started in the middle of her spine and extended to the left around her body to the midline of her stomach, completely confined to the left side. Well, they want to know what is the cause, what is the bug. Well, this question is describing shingles. So remember, you have varicella zoster virus in its acute phase. It causes chickenpox. But then later, many years later, because as you can see, she's 77 years old, a latent reactivation of the latent phase can result in shingles. And shingles is this belt-like or band-like rash that appears in a dermatomal distribution across the skin. So the answer to this question is A. Second one, 25-year-old mother takes her 5-year-old child to see a pediatrician for a rash that started on her trunk and spread to her face and extremities. According to the mother, the rash occurred in various stages. It began as crops of small red papules that progressed to teardrop vesicles on an erythematous base. These vesicles became cloudy, broke open, and then formed scabs. Which of the following is the most common complication of this infection in a normal host? Well, they're talking about the most common complication of chickenpox is secondary bacterial infection, due most commonly to chronic pruritus. And finally, a 12-year-old pregnant girl comes to the clinic because of a 3-day history of fever and itchy rash. Her little brother had similar rash 2 weeks earlier. She has received routine prenatal care, and she has had an uneventful pregnancy so far. Temperature is 101. Physical exam shows a generalized vesicular rash in various stages of evolution. There are vesicles encrusted lesions on her arms, legs, trunks, and face. A complete blood count and liver function tests are normal. At this time, you should. Is trying to touch on what kind of situation or advice you would give to her because of her pregnancy. Well, the best piece of advice or simplest piece of advice, it has to do with contagiousness. And she will cease to be contagious once the lesions have dried and crusted. So the correct answer to this question is C. Go through these other choices. Administer the Varicella Vaccine. This is actually recommended for individuals that are 12 months or greater who have not had varicella. It's not given to individuals with the disease. Choice B, admitted to the hospital for IV acyclovir. Sometimes that could be true, but this patient seems to have an uncomplicated case of varicella. She doesn't really have any significant findings other than the rash, so probably not the best thing at this time, a little too aggressive. Choice D, salicylates. Not a good choice because they're linked to Rye syndrome. And remember, she's only 12 years old. Aspirin used in a child can cause Rye syndrome, so not the best choice. And E, tell her that she is no longer contagious since the rash has already appeared. That's actually not true. She's considered contagious until all the lesions are dried and crusted, so that's incorrect. So the answer to this question is C.